Okay, good morning, everyone. Welcome back to House and Services. We are picking up H 657, our omnibus DCF bill. And we are going to pick up on, and by the way, there is a new version that's posted on the website that Katie has provided for us. I think before we go through the changes, we'll go through Ann's sections first and then come back and then kind of do a run through the whole thing. Okay, so Ann, turn it over to you.
Okay, great. And the new part for my sections is probably helpful to use because, as everyone knows, work in progress. So I've been trying to, update Katie with some of those tweaks, yesterday, just to bring
So
the
we
most
should,
up
we
to
should
date.
use
So
the.
you should use the new version
Okay.
because otherwise I'll have to be walking you through what the change
Okay.
is without seeing it. So
And tell us what page it starts on.
yes, so it starts on page 16.
Okay,
Top of page 16. So the whole first section is on restraints. And this is where there's a lot of new language rather than just imitating what Nextdoor had done, healthcare had done with the parallel statute for mental illness. Because after testimony seemed really clear, we needed to make things a little bit more structured and a little bit clearer on what the current statute sort of anticipated. So if you start from the top, the first change was an alignment that we had in there before, prevents rather than reasonably avoids, because in fact, the context of that statement that we want it to prevent physical and psychological trauma, it's introduced by saying reasonable and appropriate measures consistent with public safety. So it's not saying you can absolutely prevent it. And that's the same language in the mental health one. The second part, under B, instead of just saying the authority to select, it's making it a little more formal, designate the professional or law enforcement officers doing the transport. The contract shall require adherence. That's existing in session law from a few years left. So we're putting it right into this section. And then transportation services with non-contracted law enforcement officers shall only be authorized in emergency situations or by court order, as we heard yesterday. Sometimes the court orders a transport, and we can't dictate, what the court order, how the court order says it has to happen. Then next, there's some language that moves around. So C now is replaced just for sequential order with, I think you remember, Representative Eric
McGuire.
Representative McGuire was pointing out the importance of training. And, it's not as if we could create a whole new training certification, but this just indicates that the department will provide materials that outline what the legal requirements are for secure transportation when they're making these contracts, and get verification from those agencies that they have given the education to their staff. If there are issues that come along where there were disagreements between the Department of Children and Families and the Advocate's Office, I will point those out. So these are all things that everyone was good with. Next, making it clear, which was existing protocol, but that secure transport, calling in one of these agencies rather than the department doing their own transport, has to be necessary for the safety of the child. You don't do it otherwise, which is current practice, but it's putting it in statute. We keep the existing law on the policy of the state to not use mechanical restraints routinely. This is my poster child for the old practices which existed before this bill first passed. And then we have a section where we're talking about, but sometimes it is necessary. You can't say we're just never going to use restraints because there are real emergencies or situations where transport has to occur and there might be a real risk either to the public or to the child. So it's sort of phased in terms of, making sure that any step that escalates the degree of intervention is directly documented and explained. And so the first part is if the person who's designated, the transport person, believes the risk of serious physical harm to the child or others requires the use of mechanical restraints before or during, because it might happen while it's underway. Document, and it's going to be changed to be shall provide rather than documentation provided to, I actually printed out because I have my notes on it, the old one, but I think you have shall provide, right?
Shall be provided.
Shall be provided, okay, to the department by the designated individual, which includes a description as to why less restrictive interventions could not be attempted, or why they were unsuccessful, which is kind of our standard language around seclusion or restraint. And they already do a form where they check off, and this will be added. I had a lot of conversations with Tyler Allen, the high-end director. I've seen the form, they check off what they're doing. There'll be a little added check and a line where they can write down why this decision was necessary when the sheriff's office decides that it is necessary. The next sentence, law enforcement or private agency shall use soft restraints as a first option if they need to use restraints, and others can't be utilized if they're adequate. And then the last threshold, if mechanical restraints are used, the documentation that's provided to the department has to include that added description of why the soft restraints were inadequate for safety. And then the commissioner shall ensure supervisory review of the documentation. The next piece comes to the first one where there really has been, a disagreement. And that is the issue of shackles. The initial draft I had worked on said the use of waist shackles are not permitted.
Yeah.
End of story.
I prefer that.
Well, and that's why it's up for discussion, because the department is not comfortable with saying that they're totally banned, because they feel that there are rare but occasional circumstances where that is the only safe way. And that's why the added language is just putting it as an additional documented sole means of preventing serious physical harm. So it would require the extra documentation, but it would be allowed to happen. Then the Office of Child, Youth and Family Advocate, strongly opposes having that loophole here.
So let's just have a little bit of discussion about that point now, I guess. First off, I want to make sure I understand what waist shackles mean. Are waist shackles, the thing goes around the waist and then also around the arms?
Well, it usually connects to handcuffs. This would be, and we have a definition of them, which I can read.
Oh, okay.
That definitions.
I think the other thing.
Right on that same page.
Um,
Waist shackles means a metal mechanical restraint device, typically a chain, used around the waist and to which the child's wrists may be chained or cuffed.
Yeah, okay, that's what I was thinking.
Yeah.
All right.
They do now exist as a soft restraint version.
Is there a way to, because I realize that these provisions cover a wide age range
Well, and it also
of
recovers
people.
delinquency as well as
I get
abuse and
that.
neglect.
So I guess what I'm trying to get at is, I really, don't want to see young people even being allowed to have waist shackles. I don't want to see something like this.
Mhm.
But I can understand the things shift when you have males in particular getting older and getting, more muscular and having more strength. And so, there's part of me that understands both points of view, but I am just wondering if there's a way to strike a compromise here that references child's age.
Structurally, it would be easy to do, it could simply say the use of waist shackles are prohibited unless documented, sole means of preventing, to a child, 15 or over or something like that.
Yeah, go ahead, Brenda.
That was my question. I was a substitute teacher for years and there was a fight in the cafeteria. Those boys can be pretty strong. You wouldn't want to put law enforcement at risk.
Yeah, no, that's.
And they were
I
in high
agree.
school. I couldn't even get near them and I was trying to break it up.
But the way it's written right now, any age child could be.
Right, and I agree with
think that's right.
like first grader, but like high school.
Yeah.
Pretty scary.
Let me call on Deputy Commissioner Radke.
From Martina Erica Radke, Deputy Commissioner, Family Services Division. And I agree with what you're saying, Rep. Wood, and I think that might be a reasonable accommodation. As we haven't had legal look through it, but I'm willing to take that back.
Okay.
I think we can talk about the age. I think 15 might be even too old. I'm thinking maybe 10 or something like that.
Well, I know that downstairs in judiciary, they typically make a cutoff at 12. And they have a bill coming out this week at 12.
And that makes sense.
So it seems still young for me, I'll be honest. But if you could, maybe if Ann and y'all could work on a compromise on that inserts an age. I can't see it being used on, or being available to use on very young children who can get pretty out of control. I know. But I just.
Well, as I say,
I couldn't do it.
Yeah, I wasn't even aware that now they do have quote soft restraints. They have them as ankle and also waist. Those actually look in a lot of ways more invasive because you're kind of, almost straight jacketed.
Yeah.
But and I don't think anybody would want to see those. I think but for a young child who was totally out of control, that would.
It might, and I feel bad for the little guys, but some of them slam their head, like slam their heads in the walls.
Yeah,
I mean,
yeah.
I've seen it.
Yeah.
Could be for their safety, not to do it as a restraint, but some of them, I mean, they take their heads and they slam them and
Yeah.
they throw them forward.
There definitely is that. And there's definitely, that's why the
For their
training,
protection.
right, that's why the training part is really important because
Yeah.
there are methods to provide support to not just children, but children and adults that you would try first
Right.
before, going to
I've
that.
seen them at school take their arms and hold them behind their back, but their heads could break their neck.
Yeah, so
There's been some pretty things I've seen.
just understand, we're only talking about they're in an extreme situation. It's limited to that, but even a young child could have, their wrists, their ankles, and in a seatbelt.
Right, I don't.
So with those-
much. Yeah. No, I can see both sides.
Yeah, I think Doug had his hand up and then,
We've got to do a place that addresses the.
okay, Esme.
Yeah, I was just starting to dig into it, and I'm sure the department has done this plenty already, but like best practice recommendations for restraint in particular with from like the American Psychiatric Nurses Association and other groups. And so maybe making sure that we integrate some of those from the experts too versus like us deciding.
All of the things on restraint and seclusion in facilities
Yeah.
there are standards of care, they're, national,
for
they
sure.
all are, right. But transportation, I'm not familiar with a lot of other, where it's a different kind of setting.
Yeah.
You're out in the open. I mean, there's, in other words, more that you may have to do for safety than when you're in a building and you have more staff around and so forth. So.
Okay, so just to keep us moving, Anne will chat with the DCF folks and come up with language here that inserts an age.
Motion
just quickly, and actually Esme was hitting a point that I was gonna get to. The strengths are pretty much, it's structure and least restrictive use. Really, age has nothing to do with the assessment that's made to put an individual in whatever restraint is appropriate. And what I mean by that is, everybody's trained in like the structure, the use of it. And if the assessment is made by the person that's working with the youth and saying, well, hey, this is the least restrictive, that's the first approach. What is the least restrictive to manage the situation? But if you need to go down to those level of restraints, age really doesn't factor on it.
Yeah, I guess.
We can agree to disagree.
I know, yeah.
I understand both flip side of the coin, but if I'm in a position where I'm addressing something, the age does not factor into the current situation at hand on how I'm responding.
And I totally understand and don't disagree with the logic and the sort of methodical assessment of a situation. So I totally agree with that. I also know, because I've experienced it in my own school district, for instance, that where we had the highest use of seclusion and restraint in the state at one point in time, that because it was available and because it had become normalized, if you will, and I'm not saying the use of, shackles is going to become, waist shackles is going to become normalized. Don't get me wrong on that. But people didn't go through the steps that you're just talking about. They went from A to Z,
Yeah.
and went to the most restrictive without actually having gone through the other steps until, frankly, we had a change in leadership. And we had professional development in the training that you were talking
Mhm.
about, and sort of created a different paradigm for the staff who it was traumatizing for them as well, and I think that's the thing that to understand people doing these things, particularly when we're talking about with youth, it's a difficult situation for everybody involved.
Oh, I know.
Yeah.
I know.
You've been there. You've been there. I know you've been there.
And, but you hit a point though that I was attempting to make.
Yeah,
That structure that you don't go from 0 to 10. There's a reason why all of those mechanisms are put into place. There are reasons why the protocols, procedures, structured standards are put into place. If you follow them, it mitigates these events from occurring.
yeah. Agreed. I agree on that. Yeah.
And on the publication side of things, there's some good, although maybe not for all forms of transportation, like for EMS specifically, like there's some good ones.
So actually, because we sort of have it resolved, I didn't bring this up. EMS folks had reached out and said they may need to testify. They were worried that this would, because they do have their own protocols, which
Yeah.
actually is more permissive in terms of the needs for restraints at times,
Yeah.
maybe different set of rules. In fact, this would not apply to them,
Children, yeah.
but right. But they, and just like emergency rooms or inpatient facility as well, have their own regulations about when they can or can't, that are sort of well established, and this is a different situation, but it wouldn't apply to them. So,
Okay.
they could use chemical restraints.
Will we have somebody from the sheriff's department come in and,
We did yesterday.
oh, that was the sheriff's department?
It was.
I didn't know that one. I usually know some of them.
The online one.
If you're at the top, you gotta refresh.
Okay.
That's yesterday's.
Oh, okay. Then you get it. I didn't yeah. Okay.
Choose the back button.
Now, where was that sheriff's department from?
Yeah, right.
He was the head of the Department of Sheriffs.
Oh, you never had people that are hands-on? like-
Actually, Ann has done that.
Yes.
Oh,
You'll hear about
personally?
that.
Yes,
Okay, 'cause
I have.
I haven't seen any of my friends here.
All right. Yeah, I realize I have my notes on what the changes were, but it'd be better if I just,
Because they're all highlighted for us.
exactly. It'd be better if I just go straight to the same one that you're all looking at as I walk through it. Okay, so the next part is data collection. And it's pretty straightforward. It only adds, I think, a little bit to what was already the existing data collection that you may recall, they hadn't set up their computer program to keep up with it. And so it took a long time to get the data, but they now have it set. The issue that did come up here with some dispute is I had drafted this as all of this information being gathered on any child where they use secure transport, which is when they call in one of these agencies and these other levels can occur. And that was a real concern because we heard a lot about CWIS and how limited their ability to generate things like that are right now, and that this would have to be done by hand. So they wanted to do it just for those who end up being transported with restraints. And so I drafted it that way and then added the following section 2, which says, once they've got the new technology on board, they have to do it for all secure transport. But for now, it would just be for restraints. And
I'm not,
I'm sorry.
I'm feeling kind of, no, not lost, but tell me what the difference is in secure transport from restraint.
Okay, so a secure transport, which there's a definition part we didn't get to yet, but is
Okay.
when they call in an outside contractor, the sheriff or their private agency, who takes the child in a locked vehicle with either law enforcement driving or this agency that provides this transport, rather than just a staff transporting the child.
Oh, okay.
So
okay.
it's a higher level of restraint in the sense. I don't know, you could sort of maybe like seclusion, you're locked and you can't get out of the car.
You can't get, right. You're
Right. As opposed to then using something additional, whether it's soft restraints or so forth.
Okay.
For the transport.
So that might be considered the lowest level of restraint.
Exactly, precisely.
So can I ask the department a question? So if you're able to tell us when mechanical or other restraints are used, the lowest level of restraint, and those situations are only going to be in a law enforcement vehicle, then I'm not sure why
The private agencies, they do have soft restraints
also.
that they can use, so
Okay.
yes.
But I'm just saying, but are you considering private agencies being restrictive? Do they have the ability, like I know law enforcement back seats, you can't open them from the inside.
Mhm.
Is that the same for
Yes.
private?
Yes.
Okay. So I guess if you're able to provide us the data on the restraints used, and those restraints are only used at the times when you are calling upon outside transportation, I'm not sure why you're not able to tell us sort of that baseline of when you're using the outside. Do you understand what I'm saying?
They will tell us how many times. I could find the numbers that I passed out here. The difference is the volume. There are a lot of kids who go by, well, a lot, you can get that number. Maybe you have that number. A lot of kids who may go by secure transport, but they are never restrained. There's only a small number who are restrained. So when you have to do hand counting of the records, doing it, they can take
Okay.
on the burden of the
Okay.
smaller number, but not the full. That's what they've, and
Okay.
I could get the actual numbers, maybe.
Well, we have the, yeah,
We have
we have the numbers, yeah. Okay, all right,
So that's the distinction.
okay,
But that is an area where, I promise both folks, I would say, the Child's Advocacy Office thinks that they should have to report on all kids in secure transport. So that was a non-consensus piece.
okay,
But I'm comfortable with it, particularly with adding that they must start doing it when
they have
they
the,
have this
capacity.
CWIS.
so it'll be a data element, okay, all
Right.
right. Okay,
Okay.
keep going,
All
sorry.
right. So number 2 there on the next is that that added caveat that I'm just trying to find this page here, but
Oh, it's on page 19.
thank you. So that I'm matched up with what I'm guiding everybody through. 19, there we are. Okay, right. So on line 6, once the department has upgraded its technological capacity in a way that enables it to collect this, they will be required to collect it for all secure transport. And then the next part is the report that will really look at implementation of this part of the bill. So it's asking, this is, wait a minute, pardon me. Okay, unless that was, this is the matching language. This is new language just from yesterday's testimony from the Department of State's Attorneys and Sheriffs. They have that small number of children that they do transport under court order. They don't keep any data. The sheriff said they could easily, check it and, in other words, write it up for us. They had 12 last year. They may have a little bit more than that because if they're charged in adult court, but they're a minor, they count it differently. But this would simply require that department to provide the data to us when they do secure transports.
And so, okay, so then my question becomes, because those, the testimony I recall said, those are ones ordered by the courts.
Yep.
So that's not something DCF would necessarily have information about.
No, this would have to be them providing it.
Right. So the Sheriff's Association,
Mm-hmm.
not to be confused with the Department of
State's
State's
attorneys and sheriffs, yes.
and those folks are used, are those folks that you contract with at DCF directly, or you, I'm trying to figure out, I want to make sure there's not duplication of information, but trying to make sure that we have all the information. So I'm presuming that we don't need to ask the Sheriff's Association for the same thing.
That's right. No, they're required to provide their data to DCF
To
and
DCF.
DCF collates it.
And the best contracts with the sheriff's department.
Okay, and so then that information would then, I'm presuming that you requested the information you provided to us from the Sheriff's Association.
Tyler did reach out to
Yeah.
them, but I believe we got it primarily the
Before.
business office, yeah.
Okay,
There's a
Okay.
form they have to fill out and in order to be reimbursed, they have to fill it out. But it also is where they identify, the type of transport and so
Okay.
forth with that.
okay, I just want to make sure that we're covering all the bases because we've learned a whole lot more about transporting in this process.
With the language here, I apologize if I have myself confused, but if we just talk about the number of secure transports of minors,
Mhm.
would that also include transport of minors in the DOC system? And is that, I don't know that that's what we're looking for, but the way it's worded,
Yes, and yes, we are.
Yes.
yes and yes, okay.
Yes, any transport they do, which might be from DOC to port,
Okay.
and so forth. If they're minors, we want to know how they're being transported.
Okay. Do you want the Office of Child, Youth, Family Advocate on the recipient list of that report? Just currently has the relevant House and Senate committee.
I think that'd be fine to include them, or they could just get it. It'll come to us. It'll be a public document. I don't know if it needs to
I
be.
know,
in the
I
statute.
don't know, does DCF want a copy of that? Or,
Yeah, that'd be great.
Oh,
okay,
yeah, okay.
okay, so why don't we add DCF and OCYF?
Do you want YF added in subsection I? That's the corresponding report from DCF.
Oh, that one doesn't say,
They're supposed to be getting it already, but yes, go ahead and add it.
Okay.
Okay, and next?
okay, next we get to the definitions.
Why are they after in this? I don't understand. What the construct, why?
Why? Sometimes when we just are adding one or two, we put it at the end. I can bump it up.
Could you put?
Yeah, that's
Okay.
fine.
All the questions I kept asking, Ann says, well, it's in the definition.
Yeah, you're right.
It's
Yeah, it's easy to switch.
Okay, thank you.
So although now it's going to be bumped even further in the sense that you also don't want to repeat the whole definition in two statutes. Transportation and the restraint and seclusion part are two different pieces. And so there are a number of these definitions which go back to the kind of core restraints, exclusions.
I'll
So,
let Katie deal with that.
yeah, so.
We have the cross references.
Yeah.
Right, so the least restrictive we get to in the later bill, mechanical restraint, physical restraint. Secure transport only applies to this bill, so that definition is here. And it includes in terms of, if you would call impression of being securely held, like you can't leave. If it's a vehicle driven by a law enforcement officer, that qualifies as secure transport, even if it's not a specially locked or safety partition vehicle.
Okay.
So that's just a clarification there.
Waist shackles, I want to remove the word metal.
Okay,
This day and age, there's very strong plastic and other things, so I don't want it to be just.
okay. Katie? You- I know you're dual tasking.
I know, there are other committees asking for things at the same time.
Oh. Want me to stick Lori on them? She's your protector, Katie.
I appreciate it.
Okay,
So the next section is just the report next December, just telling us how they've implemented all this.
Okay.
So it's,
is it a one-time report?
yes, this is a one-time
Okay.
report on how they're now contracting, how they're providing the supervisory review of these
Mhm.
reports by the transporters, how they're collecting, reviewing the data, the materials that are being provided in terms of information.
Mhm. Whoops.
And I'm not sure, well, that's another one that can move, I guess. I don't, restraint is listed here for the definition. Let Kate work about that. Okay, the next section is new, is brand new, because one of the difficult things in pulling all this together is it became more clear about this distinction between when this policy that was created 20 years ago does or doesn't apply. And right now it only applies to DCF supervised or involved transports. Just as with the court-ordered ones, doesn't come under DCF. Any other kind of, we heard the story about the state police picking up this child, in testimony last week. None of that comes under this statute currently. And obviously this year in our, 1 hour of markup of the bill, we can't suddenly bring in, okay, we're going to start applying this to all law enforcement in the state. That's a big piece. And what actually, this was a suggestion from Sheriff Anderson, who's himself kind of frustrated at the fact that they are working really hard to do this right. And they know it's not, kids are not being handled the same way elsewhere. And so his suggestion was the Vermont Criminal Justice Council are the ones that establish the statewide policies that apply to local law enforcement, state police, so forth. And they did this major lift of a use of force policy for the state, and didn't drill down into this subgroup of how one uses, secure
On minors.
methods on minors. They didn't do it as a separate look. And so we're asking them, along with all of the, the key players, getting input from the advocates and so forth, to look at whether it's not imposing at this stage, thou shalt change it, but whether it needs to be changed to include what's called an appendix to the use of force policy. Now, originally, this was drafted to include mental health because they have the parallel statute. And it turns out they did an appendix for mental health. It was thanks to the Judiciary Committee chair looking at this, who said, what it ought to say is not whether they should rewrite their use of force policy. They do appendixes to it that become a part of it. And that's the way to phrase it. So the Judiciary chair has reviewed this. They don't need to look at it or take the bill. We adjusted the language per their recommendation.
So are we taking out mental health?
Yes.
Okay,
Isn't that's not removed in this version?
no.
Oh, okay.
Taking out
Okay.
mental health.
Yes, I'm sorry. if
It's
I
already
didn't-
been done for mental health, that's why.
Right, so we're taking out believed to have a mental disability, and we're taking out the last line of persons in the custody of the Commissioner of Mental Health.
And so I want to make sure that I am clear about this. What I think I heard you say is that BCJC provides the guidance and policy for all law enforcement. So we don't need to
Correct.
separately list the
Correct.
sheriffs, the state police, the local, okay.
Right.
So, okay,
They're all on the council.
They're-
They're all a part of that council.
so do they adopt the policies?
Yes.
Okay. So, I think that, the one thing that I don't see covered here is the Department of Disabilities, Aging and Independent Living. Because they do have youth,
Yes.
with developmental disabilities,
That's
but
right.
I'm pretty sure there's no appendix for.
You are right.
We talking about,
Section 11.
Section 11.
Okay, so remove the MH and add Dale.
Yes,
Okay.
yes. You said mental health.
Oh, right, I'm sorry, remove DMH,
And
yes,
add Dale.
yes. Forgot they were still in there, yeah. And is the Office of the Attorney General still there? Because we struck that also. It turned out, I didn't know that Sheriff Anderson had suggested that they needed somebody to provide the legal assistance. And the Attorney General's office said, wait,
BCJC has their own.
they have their own,
Yeah.
right, so we
They're,
eliminated
they're
that.
eliminated, they're not in here.
Okay, all right, good.
Okay,
All right, so then we break and go into the restraint and seclusion piece, which is about residential facilities and children more broadly in the custody of DCF when DCF has authority over that. Now, this is where we got into this complication of just like we can't, these laws can't apply to the Montpelier Police. They also can't apply, DCF has no control, for instance, over what an emergency department or an inpatient hospital, they have their own regulations. So we can't say, DCF, you have to enforce this. There is a section that will address, what about if it is something where DCF doesn't have authority? Some guidance on how to deal with that. But this all has to do with facilities, DCF licenses. You'll see that later in the definition of child, which is what applies to all of this. So the first is that as an initial premise, prone restraints, mechanical restraints, chemical restraints, or strip searches on a child are prohibited. Do you want to skip to the definitions, Madam Chair? Yeah, so let's look at them now so that when we go through it, people will know what each of those mean. So that would be, I believe it's page 26, it might have shifted.
yeah, the very bottom of 26.
Bottom of 26,
Yeah.
okay. So some of these definitions are very standard. Chemical restraint is one that's standard. Some of them are actually drawn directly from the existing DCF rules and regulations. So chemical restraint is a medication that's used specifically to address behavior. It's not a medication that's needed for an illness. And that is not permitted at all in residential facilities. That does happen in inpatient hospitals, for instance, including for children. Child or children, this is sort of a really pivotal one because it's basically saying, who does all of this apply to? Well, it's a children in the department's custody or any child receiving care or services in a program regulated or licensed by the department. So even if it's not a child in the department's custody, if it's a child who's in a program they license, you can't have different regulations for the kids who are in custody or not in a program that the department has licensed. So that's who's covered by everything in here whenever it says child. Mechanical restraint is any kind of a device that's not a staff person's hands, physical. It's any kind of a device that restricts freedom of movement. I have to say there was one phrase in there, I can't quite picture what it is, but it was the DCF regulations that use that. So I just picked up their definition. don't ask me what a
Adjacent to?
garment, yeah, this is number 3.
Oh, yeah.
A garment adjacent to the child's body that restricts freedom of movement. I can't
don't know
quite,
what it is.
I don't know what that is, but I felt like it didn't matter. That's their,
What is it? Do you know
that's their
what does
definition.
that mean?
Let's see. Oh, a safety smock, I believe.
So a safety smock is not put on the child?
This says adjacent to the
To.
child's body.
Adjacent to the
I think that's the off word, adjacent.
Yeah,
I think it's otherwise what it sounds like, just. the
yeah, a
word
garment
adjacent.
attached to the body is like a smock, right? But a garment adjacent to the child's body that restricts movement. I was like,
a word of art at some point.
I mean, I suppose we could strike it. I just figured since it's existing and so people must know what it is, just use their definition.
We'll get some clarity where Tyler is gonna be jumping on, he might know.
The only thing what comes to mind, which is not something that I actually would want to have, is some sort of garment or equipment that is attached to a wall and that you're then putting the child in.
In that case, yes.
So, but when Tyler gets on, let's ask him, because if that's what
Well,
it is.
these are all things that are banned. Except for the
When you
secure
can
residence.
use, yeah,
Well,
except for when you can use them.
yeah,
I'm not sure you'd want to use that.
right.
So
That's
let's
right.
find out what it
Yeah,
is
okay.
first. Okay,
That's fine. Yep.
all right, so just a question mark around what adjacent to means. Do you know what adjacent to means? Eric?
No comment.
It means what I think it does, doesn't it?
She was on the right track.
On the right
That's right. It's a restraint that was up on the wall and you go in the restraint and they were actually hitting the wall.
Yeah, that's not,
That's not how the whole concept is, so that's why I'm refraining from going any further.
Yeah, okay.
that's what I thought it was. That's
Okay.
that's the vision it gives me. So I didn't know if that's accurate, then we will not want to use adjacent,
Then it wouldn't be banned anymore.
except for you can't. All right, well, we'll talk about it.
Yeah, well, when we get to when it can be, yeah.
And some.
Okay.
All right. Physical restraint. Again, this is mostly drawn from DCF's regs. It's using a manual or physical hold. And it clarifies, it doesn't include if you're putting your hand on the kid's shoulder and saying, come on, we need to go here.
Yeah.
As long as the kid is able to pull away, that's not a physical restraint. Prone restraint, this is really an important clarification. A prone restraint is pretty broadly recognized around the country. Many states have banned the use of prone restraint in schools as well as in residential facilities because they're much higher risk of the child not being able to breathe or to communicate that they're in distress if they're being held down face down on their stomach. However, there are some best practice things, and it I guess depends on where you are, if they've been adopted or clarified, where if you have to bring a child down in a prone position, which at times may be safer than, if you're going to, twist them around and put them on their back right from the beginning. You bring them down prone and then immediately move them into a breathing, able to handle it. It's actually New Hampshire a few years ago adopted a statute banning prone restraint in schools and residential facilities that makes this specific, I drew most of the language from it, that says if it's a momentary hold in order to transition to a safer form, that's not considered a prone restraint. This addressed the department's concern about having a total ban on it because this, they believe, is often definitely the safer way to approach it. It doesn't permit holding a child down in that position
It says
for any amount of
momentary,
time. It's momentary. Yep.
So, Tyler, good morning. We have a question for you.
Not the one we just talked about.
Not that one. We're talking about mechanical restraint, the definition of mechanical restraint.
Yes.
And it refers to device, material, or equipment or garment attached to or adjacent to the child's body. Can you describe what adjacent to means?
Actually, I had that question. I'm not sure what adjacent to meant on it. I didn't call it out as a specific area of concern because my assumption it was putting in some sort of, confined space where a person couldn't maybe lift their arms or something like that, or putting a block in place, but I wasn't sure what that meant
Well,
either.
so, right, so this is one of those areas, Tyler, where this was language that I included only because it was in the department's regulations
Regulation.
defined that way. I didn't have a clue what it meant, but I just thought, well, they must know.
Okay,
I believe Chris Ward or somebody over from our licensing unit might. I'll send a message right now and see if they can answer that question.
thank you. I think it's information from eras gone by, to be perfectly.
Yeah,
honest.
probably, yeah,
That
we can,
We're not gonna want it here,
right.
or we're gonna want to. So I have to go back when we get to the top part.
Yeah.
And how these, when it's
Well,
allowed.
how it's applied,
Right.
yes,
Yeah.
okay.
Okay,
All right, so next is strip search. Again, this is sort of a standard definition of what a strip search means, which is what it sounds like. You're disrobing, you're not just taking off your t-shirt, you're having to strip down so that your private parts are visible. It doesn't include a pat down through the clothing.
right. So I have a question.
Mhm.
Would this, do these prohibitions follow the child to a location that isn't licensed by DCF? And I'm specifically thinking of the Brattleboro Retreat, who does utilize strip searches. So if they're in DCF custody and they go to the Brattleboro Retreat, it does not,
It does not.
it's like that's the emergency room of a hospital.
Exactly.
Okay, they're governed by other things.
That would have to be a whole different, and maybe it needs to be looked at by this committee,
Yeah.
but it wouldn't be in this bill.
Okay, all right. It doesn't follow the child. then.
Right.
Okay,
Least restrictive, which also applied to the transportation statute, which had been brought up in this committee. There ought to be a definition. I hunted all over the place, talked to DCF. Nobody has a definition. They just kind of use it all the time. So this was a definition based on the context of best practices in a lot of places. This is just a description of what that means. The minimum intervention necessary to prevent harm, that something that maximizes the child's autonomy, ensuring that restrictions are proportionate to the risk of harm, and that involuntary measures are only permitted as a last resort. That's the context of a lot of descriptions of what it means. It's not placed in a definition anywhere. So I didn't take it from some other definition.
is it, you just referenced in the previous section that it was referenced. I'm just trying to look to see, did we repeat that definition?
Oh, no, we cross-referenced it, I believe. Yes.
Okay.
Yeah, we said as written here.
Here,
Yeah.
okay, thank you.
Soft restraint, again, that's a standardized definition. It's using soft material or fabric that's designed to fit around the limbs. So it is officially a mechanical restraint because it's not manual, but it's a type of mechanical restraint that's using soft materials. And then again, finally, secure residential program, because there's some specific things that apply only if it's a secure residential program. And that's the department's definition of it.
Okay. Any questions on the definitions other than the one we had?
So we go back
So
then
let's go
to how do the definitions apply?
Page.
So that is going back to 22. Well, 21 or 22 in the new one.
It's 22. and
Yeah,
21.
okay. Restraint and seclusion, and this is where it starts off. The basic premise is no use of prone restraints, mechanical restraints, chemical restraints, or strip searches. And the preview on that is that there are some very limited specified things that say notwithstanding A. So when it says notwithstanding A, you mean it's going to cue you that this is an exception to this starting rule. B is simply a very standard description of the fact that, you know, it can't be used for punishment. It's only a method of last resort to prevent. And you'll see that term again and again, serious and immediate risk of harm to the child or another person. That's the standard that's used, you know, by DCF, by, you know, best practice. And the same thing when we get to C, that this is a standard best practice threshold, that before using it, there has to be an attempt or considering other less restrictive interventions and determining that they are, that it was unsuccessful or likely to be ineffective. So there could be an emergency on the spot where, you know, child's running out into traffic. You're not going to stand there and say, I wonder what I could do less restrictive. That would be, you've considered it and realized on the spot, it's not gonna save this kid. So you don't have to go through this long thought process. But usually things are escalating. You don't want to prematurely say we need to use something highly restrictive. If you can talk the child down, if you can do things that avoid it. And that's the standard for that.
All right. So I'm not really happy with the consider attempting. We already say that this is, well, we actually don't, for the child's safety. After attempting to use less restrictive. So I understand the example that you used. And I'm just trying to pull back from my memory, a bill that was drafted around restraint and seclusion in schools. And so I get that it's only used for, you know, when there's immediate threat to the child's safety. But I think we can say that, immediate threat to the child's safety. I think that it's too broad. I think that considering it, because it's, in this case, applicable to any time you're using it, it's too broad. Do you know what I mean?
I understand what you mean. I think we need to make sure that it does recognize that there are times, because shall attempt, if you don't have consider attempting, you're left with shall attempt. I think there needs to be some clarification, or there's times when you can't actually attempt it because it's so urgent.
Well, I think like maybe the lead-in sentence to C is, you know, the use of any physical restraint or seclusion is for the child's safety and the safety of others, or something like that, where I know that that's the whole intent around this, but then
It's implied, but
it's not explicit. And
well, if you see D1, that's explicit there, but I understand what you're saying still. You can't use them unless D1, unless it is a serious and immediate risk of physical harm.
right. I just think that needs to be the first thing that is stated. You know, I think that needs to come up.
So
Up
let's
in the
back up
list.
to B.
Yeah.
Look back up to B.
Yeah.
And it says, shall not be used for any other reason other than as a safety measure of last resort
Yeah.
to prevent an serious and immediate risk of harm to the child or another person.
Yeah.
So it's both lead in and,
It is.
uh,
I'm just
Yeah.
having a pause on the consider attempt.
right, there may be better words, or shall attempt or,
But just consider and take out attempting.
or,
Is it that
Oh,
you,
that might be.
you want them to have thought at least more than just reacting
Well,
immediately?
I mean, they're gonna need to react in a situation like you
Yes.
just
Yeah.
said.
Yes.
If it's a young child and they're, you know, somebody's, you know, they're running out to the street or something, they're, you know, gonna touch a hot stove or something, you're gonna need to do that. I just, the consider part is the, but maybe it's when removed from attempting.
Absent exigent circumstances, the staff member shall attempt.
No,
I'm sorry, say that again?
yeah,
Absent exigent circumstances, a staff member shall attempt.
I think that's
They're
excellent.
less restrictive.
Yeah.
And drop prior to using, because we know this is prior to using, it's the steps here. And in fact, D says after attempting to use. So
Right.
we don't need that prior to using. You said, I was going to say it again, but maybe Katie already got
I think I
it.
have it.
You
Thank
do?
you. Yeah.
Okay, perfect.
Okay, thank you.
All right. All right, so now we get to after attempting.
Before we go, if I could just revisit A, just very quickly. It's very bright line rule here. The department shall not use.
Yep.
But you say later on there are exceptions. Do we need to reference at the top there that, and, you know,
Notwithstanding.
notwithstanding exceptions outlined in this section, the department shall not use. If someone doesn't go all the way through this, there's a very clear no exceptions reference in the first line of the section.
So that's probably a drafting question.
Yeah, I think there's a little bit of a polychoice. I think probably it's fine the way it is to have the rule and then the notwithstanding fall after it. If you feel like it could be some confusion or that somebody wouldn't read the whole statute, I'm happy to add the language in, and then it's in both places.
So I'm gonna make an argument for the opposite. I think we actually should be definitive about the statement. And then outline the exceptions.
As it is written now.
As it's written now.
Right.
Yeah, I just think it's an important policy choice to,
Just
Say.
say, we don't want you to
Yes.
do this.
yeah.
Because they are extremely narrow. You'll see when we get to them. There are two, they're only for the secure residents, for one thing. The exceptions and there are for two of them. So I think it would be difficult without making it a lot longer to start even referencing the exceptions.
I get your point, Doug.
Yeah.
I do get your point. But I think we are making the policy choice to be definitive about it.
All right.
Oh, I'm sorry. Yeah, this is just discussion. So
Okay.
yeah, you don't.
Yeah, I was looking at the State Board of Education's rules around this and how they say you need to do this first before you do this. And I kind of like this language. It was less restrictive interventions have failed or would be ineffective in stopping such imminent danger of physical injury or property damage, because it's a little more like than consider, I think, what you were a little caught up on, which I
Considering,
completely
yeah.
agree. Like it's like more of a checkbox than a mental checkbox. I don't know if
Can you just cut and paste and forward that to Katie? And then if we can just kind of like,
So we can compare side
so we
by
can
side.
compare it, yeah. Put it, yeah, put them both in, yeah.
I will throw in, and I'm not disagreeing with.
Sorry, just a
Oh,
minute.
sorry.
Now, if they only monitored and assessed school districts in the use of
Right,
that
because they don't.
policy.
oh god.
Sorry,
It's a
I had to
good
say it.
policy.
Yeah, it is a good, the policy
Yeah.
is written is fine. The problem is that.
So I don't remember if this is one of the word for word, to the extent possible, I use the same sort of terms of art, if you will, the way it exists in current, some of this that's in current policy, because everything you change in language is a retraining thing.
Mhm.
So if it doesn't make a substantive difference about what we're trying to do, but it might be better language, I'd rather not change it, but this may be substantive. And also keep in mind that all of this has to go into rules, which will be much more detailed. We're just outlining, these are the key pieces. So, okay. D. So these are sort of the criteria for, if you've done what you have to first, and you've been trained in accordance with the rule, you may physically restrain, and remember that's defined. This is not mechanical restraint. You can physically restrain or place a child in seclusion, which is not a banned, not on the list of banned. These three things. You've, again, back to that, you've determined that it poses a serious and immediate risk. You conduct it in a way that respects the child's privacy and limits physical and psychological trauma. There are a lot of times when we say and prevents physical and psychological trauma. That's been pointed out in several places. We're kidding ourselves. You can't do this in a way that prevents trauma, or you certainly can't in most of the time. You can limit it. You can try to do it in a way that limits it the most. But unfortunately, there's always going to be some. That's why we don't allow it except in an urgent situation of harm. And then one of the criteria is also that right after the intervention, you have to explain why it's happening and what a child needs to do to be released. There was a point at which that was one of the things that you do before, and I think it was Marshall Paul, or I don't remember who, one of the advocates who was saying, if I talk to my kid and say, this is before I intervene and say, this is what you have to do to get out, that's not really appropriate or viable, but you need to let them know right afterwards. The next part, E, is again a very standard practice. I'm losing the term there. That's evidence-based practice. That this is for the emergency, for the risk of harm, serious and immediate risk of harm. So whenever that is no longer present, child has to be released immediately. And then we get to the next section where there is not consensus on how to approach this. Because the starting position had been no child should be held for more than should be in seclusion for more than an hour. And the department felt rather strongly that there are rare circumstances, but there are circumstances where a child would need to be in seclusion for more than an hour, and that there should be a threshold of review, but that it shouldn't be banned on a specific time allowance. So after that, I actually went back to the department's regs. I had kind of left the details to rulemaking, but had just put that 1 hour limit. So I went back to, they actually have a 10-minute threshold and a 30-minute threshold. So I put that back in, which puts in a requirement for more ongoing review. Has to be approved and oversight by the supervisor. And if it's lasting more than 30 minutes, clinical and administrative approval.
I think that should say administrator.
Yeah, we have
yes.
it already.
Well, okay.
It'll be administrator on duty.
Well, that we haven't got to that sentence yet, because then that's the third level. The third level is the more than an hour, which is the contentious one. And so that's where it now says it has to be an in-person assessment, not a consultation, an in-person assessment by a clinician and authorization by the administrator on duty if it's ever going to be beyond an hour for seclusion. Restraint is not permitted to go on. I mean, you can't. You wouldn't be able to physically restrain a child. It hands a manual restraint. That was acceptable to the department as if it absolutely had to be. The advocate's office, strongly disagrees. In my mind, there's a question that's valid to be raised or grappled with, and that is what would we be expecting them to do? Now, you can say all sorts of things about, well, it shouldn't end up that way. There should be interventions that are good enough that within an hour, you can have the child calm down enough that they're not an immediate threat. You can argue that, but the flip side is, what if, for whatever reason, what if that child is still a danger, is still an immediate danger if they're released from seclusion? What would we expect them to do if we say you cannot have them longer than an hour? So that's the discussion point for the committee, where I put the language, but it's a key decision point.
So Matthew, I see you have your hand up. Thank you to the person to my left. I just want to be clear that at this point, this is not about advocating for your point of view, but if you have additional information around clarification or question, that's allowable.
Thank you, Madam Chair. I'm not sure. I don't know how to advocate for my point of view, but I understand your point. On this topic, I honestly would like to hear from the department or anybody in the room an actual case of a child being restrained for an hour or more, because I
This
have
is
never.
seclusion, not restraint.
I'm sorry.
It says both.
No, no, well.
No. I said the wrong word. I apologize. I meant to say secluded. Sorry.
Okay, yep.
I understand. And the actual example of a child being secluded for that amount of time, because I don't think that's a real scenario. And I think to do so is incredibly traumatizing to a child. So can someone from the department help me understand or?
Thank you for that question. And we will check in on that. We do know that there have been past cases in the press where that actually has happened. Not recently, but so do we have data? I guess the question is, do we have data, from current practice that says that this has occurred? What kind of data do we keep on this kind of situation at this point in time? I guess that's a question for Tyler.
Yeah, thank you for the question. I think it is a good question. I think this is one of those challenges where I agree with Matthew. This isn't something we see in practice. We're not seeing long-term seclusion or certainly not restraint. The idea is these should be as time limited as possible. But I think our feedback was if the circumstance is such that the imminence is still there, the unsafety is there after 1 hour in a secluded environment. If you have a youth who is unwilling to safety plan, for example, is actively threatening a peer or somebody else within the institution, can you safely put them into an integrated space with peers when they're communicating that their intention is to do harm? It's a hypothetical, but if we put it into law that there is a specific time frame by which we have to reintegrate them into a population, should such a situation as that occur, it puts everybody at risk.
So you didn't answer the question about whether there's any
Sorry.
data.
So we do have data on each incident report that happens. So
Have you seen any? I'm sorry, have you seen any?
I have not seen a circumstance by which we had over an hour that somebody needed to be secluded or restrained.
Okay. Okay, Matthew, I'm going to decide after you ask whatever it is you're going to ask, whether we're going to continue in this manner or not.
Thank you, Madam Chair. And I want to say for the record, Matthew Bernstein, Child, Youth and Family Advocate. I just wanted to clarify, because I appreciated what Tyler said, that again, we're not talking about stepping down from a seclusion to a non-seclusion does not require integration of the child back in with their peers, right?
Okay.
It only.
All right. So Matthew, I'm going to stop you. Sorry, you've crossed the line in terms of. I don't mean in a negative way, but just in terms of where our process is at. Okay.
Well, if I might just clarify real quick why it is germane, I think, because in terms of the question as to whether an hour is necessary or not, I'm saying that integration with the peers, that you can step down from a seclusion without having to integrate the child with their peers. So I'm just saying that I think to echo, it is incredibly rare that it would have to go on in terms of the safety of other peers in the space for more than an hour. So just to clarify, that's what I was trying to say.
Thank you. Okay. So let me get a sense from the committee in terms of where you would want to go in there. I mean, I think the requirement that there's an in-person assessment by a clinician is, for me, the safety valve of assuring that nothing goes on beyond what's absolutely necessary. And that clinician can say, yeah, this person doesn't, you don't have to reintegrate them, into, if there are more youth in the same building, they can go to their bedroom, or they can, go to a other room where they're by themselves, or, with staff. So I'm just saying, for me, the in-person assessment, I wouldn't feel comfortable without an in-person, face-to-face assessment. But that's just my thoughts. Other people have thoughts.
Yeah, I agree wholeheartedly, because I like to know, like, when a child's in seclusion, what type of monitoring, assessment, and documentation is going on while they are in seclusion?
Look at number 2 right beneath it.
No, I mean currently.
Hmm?
Because if there's some level of monitoring, assessment, and documentation going on currently while they're in seclusion, the time really doesn't factor on in as the assessments are being going on. You're assessing the situation, recognizing, taking in all the facts, taking in the monitoring, taking in the documentation. Therefore, the setting a time in statute could be detrimental and harmful to both parties. So I look at things more in regards to you're monitoring and assessing, and you're using the assessments in the case plans to respond to the situation.
Yeah.
I don't mean to get all like, the thing, but
I agree with you. I think that the point is that we have to think about the kinds of situations where this could occur. So, for instance, at night, when you don't necessarily have the clinical staff on site, you really have got a lower level of staff. I mean, in a 24-hour situation, a residential situation, you don't have the necessarily the level of professional assessment available to you.
that's where I'm kind of going with.
Yeah. So, and I think that this could occur in times when weekends, for instance, or other times when you don't necessarily have those professional level staff available to do, that in the moment. So, I think that there does need to be a safeguard of time, but I think that I think I wouldn't feel comfortable with it unless it has that in-person assessment. And
Absolutely.
That's,
Yeah.
So.
And I do support what Matthew and Tyler were saying. That is true. These are 1 hour are very rare. We're talking between that 2 to 5%.
So I don't think that this inhibits safety issues for the child or the other children and staff in the building, but I think it does provide a protection for the child who actually is in seclusion, not restraint. That's restraint is being.
Yeah, restraint is not a part of that,
Part of
because
that.
I actually had a quick consult right before we started saying that, we
you have
were
that
duplicating the language. We're not I already talked to her.
Okay.
about it.
Remove this.
Removing restraint.
I have that already.
Yeah.
Will this be going to judiciary? Because this really, to me, seems like something they really need to see.
We've actually been in consultation
No,
with
but
judiciary.
will they be part of this bill?
That will be if they decide to, and I've already notified the chair
Yes.
for him to take a look at this most recent draft.
Yeah.
Representative
It would
Donahue.
be more their field. I'm like, I don't know
This
about the
actually is
rest,
not-
so I'm not qualified for this.
This is
It's
not
not
their
a
field.
it's not a criminal field. It's a clinical field.
Okay.
But if
Yeah.
they felt that it was something they needed to look at, they've been told.
I wouldn't be able to vote on this, but I mean, I know I can't abstain, but I am not qualified to vote on a bill like this. Okay, thanks.
Well, none of us.
Yeah,
think, except for
I
perhaps
couldn't-
Eric is
No,
So I wouldn't be able to vote on a bill like this.
That's what we call a citizen legislature representatives.
Yeah, I would have to, I couldn't vote on something that could possibly be a danger to an adult or a child. So,
That's what that's what these are all putting in place so that we avoid that.
but I don't see it avoiding it. That's what I'm saying.
Okay, all right.
Only because I've witnessed it.
Okay, go ahead.
I'm just trying to get clarity on what you were saying earlier, Madam Chair, about the challenges of weekends and overnight and sometimes the lack of availability of a clinician. How does that jive with for an in-person clinician? How does that jive with the 1 hour? I'm just trying to.
Hopefully they're on the phone in consultation saying, we got this situation happening and,
They would have to be called in.
yeah, they'd have. to
That's
call them.
why it becomes a higher threshold. And in fact, that was part of our discussion when the department said, well, it would be, we'd have an assessment and all that. And I was the one who said, well, what about in person as like, we want it at the very highest level. They have to be so sure that they can't get around it that they're willing to call in a clinician if they
Yeah.
need
So
to.
it's working with an on-call clinician and then the
Yeah.
physical visit.
Mhm.
So it seems to me that, listening to this conversation, that the issue of time and the issue of the severity of the situation aren't necessarily related. And so we're putting these two together and maybe they're not related, actually. Maybe it's just it might be smart to take the time out altogether. And just allow the severity of the situation to be the
But if it's not severe, it's going to immediately end if that significant danger is not there anymore.
but what if it's not related to time?
Well, it wouldn't be related to time, but we're just saying there's an outside threshold that we shouldn't ever be crossing unless the severity is enough, where there's got to be a clinician who says the severity is such that they actually do need to stay for much longer than most people would, I don't think there'd be disagreement that longer than an hour in seclusion is damaging to a child, is not a good thing to happen. And so it would only be allowed to happen if it was severe enough that a clinician is evaluating and saying, yeah, this child has to, even though we know it's harmful to be in seclusion that long. Does that make sense?
I hear you.
Yeah.
But to the flip point of saying, there's also the potential to where a child is in seclusion and, the person saying, well, after 10 minutes, let them go. There's the potential to turn around and saying, no, we're going to keep them in there up to the hour.
Which we don't want them to do. Right. So that's what.
No, but what I'm saying is.
Yes, I understand what you're saying.
Because you gotta look at the flip coin of some of
it's
these
the other
things.
side of the coin.
Unfortunately, it's just
It's easier, but that's why we've got the 10 minutes and the 30 minutes.
And maybe to prevent that from happening in the first place, making sure we're very clear in statute that to unjustly do the restraints, like instead of considering something less severe, like having very strict language, like,
That's why the assessments, the documentation,
Exactly, yeah.
the monitoring is key to the progress of deciding when the support or that needs to be relinquished.
Yeah.
That's why
And
sometimes
that's what-
with timeframes
I
can
feel like we
become.
have that part
If you go
covered.
back to E,
Yeah.
shall be immediately released. If there's no longer serious and immediate risk.
So
So I
that
think we're
covers
really
that
clear.
covers your,
Yeah,
That's a requirement.
But I hear you on the impulse of first reading that could be, but the context I think is very helpful, like the E piece.
yeah. Yeah, we kind of get stuck when we go down this rabbit hole on this like one piece of language. We got to remember what comes before it and what comes after it. So, at this point in time, I'm going to make the call to leave it the way it is, and move on.
Number 2 here shouldn't be controversial. That is direct language from DCF current regs. If they're going to be in seclusion, and restraint is not included here, that if it didn't get crossed out by mistake. This applies to seclusion, constant uninterrupted supervision by whatever type of supervision they have, but it's got to be constant and uninterrupted. But we get immediately to the next of, I think there are about 5 altogether. So the next non-consensus piece, and that is one of the exceptions, which would apply only to the secure residence, has to be done, it has to do with a locked bedroom during regular sleeping hours. So not the use of a locked bedroom, which really is seclusion. But the department feels that in the secure residence, which is, you know, nobody wants to admit and call it a detention facility. It's like treatment, crisis intervention, but it is the closest we have, as far as I'm concerned, it is a detention facility. And so the question is, do we exclude from the term seclusion if you're in your bedroom, what if you were in a detention facility would be your cell, in fact, their bedroom design, but during sleeping hours, that the room can be locked so that staff doesn't be, I don't know, sitting outside the door and so forth. And they have very, very robust staffing, which is why it costs so much for these small programs. But the concern, I'm trying to articulate their concern, is if you have several kids who decide they want to, you know, pull a little escape attempt, and kids may want to try to do that, right? That they could team up. And even if you have 3 staff on duty, but you've got 4 kids, you know, if they hatch a little plan.
One gets away and the other 3 get caught. I don't know. I don't
Well,
know.
but they all go out and try to jump the staff or whatever. So,
I know.
you know, it's, so this reflects the department's position, and this is an area where the advocate strongly disagreed with having this exemption.
Yeah, I have to think about it myself, to be honest.
Yeah,
Um,
I understand the concern. I'm very much on the fence, and this was one where I said, I'm bringing this to the committee. This is a difficult call on this, and
Does this language reflect current practice?
yes, they do lock them in the bedrooms at night for sleeping. When we took a tour of the
They said, no, they
facility-
did not.
Well, it was a little ambivalent, but I know you made a
I
specific
did.
reference to, I hope you're not going to do this. Of course, it hadn't opened yet. And that was the former commissioner who said, no, we're not going to do that.
Yeah,
But
and they promptly did. So is there a way, so I guess my question is whether, is it regular practice or is it only practice in certain,
It's done every night.
you know, like when it's been a rough day and the kids have, you know, had, you know, like when there's been, you know, this essence of stress in the facility, in the home, or is it just like, this is normal practice? And honestly, I feel like, you know, we are paying for a lot of staff in these facilities. And so, and we are, you know, we were told yesterday in a meeting that it's staff secure.
that's not this one.
It's not this.
This is Red Clover only, which is not staff secure, it's locked. This is
Okay,
secure.
so how do so what did I miss?
If it's-
Here, saying what it
Definition.
applies to.
If it's
What
locked,
places.
if it's locked, why would every bedroom need to be locked?
Well,
If you put the
that's-
lock in combination with,
They can't escape, but they could assault staff or another child. So that's the,
I know we're
Yeah.
concerned about the overnight staffing ratios that put the staff in greater position of vulnerability, because
There's-
wouldn't the same be true during the day?
during the day, there are other staff present in
Yeah.
maybe other roles. There might be a therapist, an education person. So there is a level of people, the ratio is higher.
Yeah.
There are 3 full-time, frontline youth
Well,
people for the 4 bedrooms.
I guess to the chair's point, may be situational, depending on what the atmosphere, if you will, is at the facility, and may it be clinician approved or supervisor approved or something, that it's not day-to-day practice, but it remains an option with some checks.
But just to go back to the background question, Madam Chair, secure residential program is defined. It means a secure residential program that employs locked or inoperable doors. and windows to prevent leaving. Whereas a staff
Sorry,
security,
what page?
it's page probably 28, number 9, the definitions that we looked at.
Right, but where does it say in here that this only applies to that?
Oh, right in it itself, the definition there of, now I've lost my page.
It's saying that this is added to section 5130. What's 5130, Katie?
That is the section on transport.
Strange.
Okay,
It's, no, well, it's G1 is what we're looking at, and it says nothing in this include
I
in
know,
a
but-
secure residence, in a secure residence. That's where it says.
I
this
know,
is
but this whole definitions of when seclusion and restraint can be used,
Yeah.
it doesn't say that's only in residential. That's what I'm trying to understand.
Sorry, 5130 is the restraint and seclusion section we're looking at.
5130.
Oh, right, that's the number right there.
Yeah.
Okay, so what is the ellipsis referring to? So are we in,
a new chapter.
when we're adding, right, and when we're adding, what are we adding this to? That's what I'm asking.
This section 12,
Yes,
we're adding it to an existing chapter on Title 33 in the Green Books.
but is it, I'm sorry.
Oh, you're asking, is it specific to just children in residential treatment
Yes.
programs? I don't think it is. I think
Right,
it's.
that's my point. So I don't agree with you in that.
Okay, we'll check that.
Can I throw something out
But
there?
if this is,
Not yet.
but this is saying it does not include in a secure residence. This is limited to a secure residence.
The rest of these
Oh,
definitions
the rest of them,
are
right.
applying to any program,
Yeah.
any program
License,
license
that-
or,
that would be
Where-
correct, yes.
okay. That's what I'm just trying
I'm
to get
sorry,
at.
yes.
Okay, all right, now,
The locked rooms.
yeah,
Think about it. They're co-ed. Think about rape. Think about boys sneaking in the girls' rooms. Would the state want to be charged for rape?
Well, there
I
are
mean,
it's 4
There's a
bedrooms.
reason why they do it. And they're co-ed. I know boys and I know girls because I used to let them both spend the night and I had to stay up all night. watching them.
They are all night over, they are awake overnight staff.
I know, but.
so I guess I will say that we're gonna take a break in a few minutes,
Very
so you know, which would be good, I think.
Scary.
I have concerns about fire protection. I have concerns about an emergency situation. And there are less staff on at night. But still more than typical.
Those numbers.
Mhm.
Could you?
The number of
staffing
staff.
Like night versus day.
Yes.
Just, we say it, yeah, it's helpful for.
Yeah.
Yes.
So I'm really just grappling with this locked bedroom thing. Yeah, go ahead, Erica.
So just like to add in terms of, when we were talking about perhaps limiting the locked bedrooms to, times of intensity where there may be something going on. My concern would be that when there's something dangerous like that happening, is it realistic to then expect the workers to be going then to lock the bedroom doors? I think that sort of like then the cat's already, out of the bag. I think that having the standard be the way it's in practice now actually provides the safety. But I do see your point about fire.
Oh, yeah.
Concerns about fire.
That would.
Yeah.
To try to, once they've already started to maybe come out and maybe gang up on staff to try to lock folks in, then I don't think with the 3 people we have on duty, you're gonna be able to do both.
Yeah, no, I get that part.
I'm worried about.
Do you know, and maybe Tyler knows the answer to this question. So like at Red Clover or at like West River Haven or that way? Okay. Are the, like if a fire alarm goes off, do the doors automatically unlock?
I'm gonna have to get that verification that they automatically do. I believe so, but I need to verify that it is an automated locking system. But there are oh no, I take that back. There are keys to those doors, so they would have to be unlocked.
Yeah, fire would be a problem. That would be a problem.
The reason it passes fire safety is because it's the building is fully sprinkled. So there's that that level of fire protection in place.
Yeah,
Akin to how it is in other detention center, if you have each room individually sprinkled, that there is that assurance of fire safety.
the bedrooms are all individually sprinkled.
That is correct.
All right, I think now's a good time to take a break. We've been at this for an hour and a half and, I need to think about this one.
And I need to run down
Yeah.
to corrections to run
Yes.
their language by them. And when I get back from